So I wanted to talk today a little bit about UTI. We're all in a facility where the people who live here are a little more likely to have a UTI than, the general public. So as caregivers, as we are the people who are caring for these people, we want to be aware of kind of what are the treatments, how do you recognize what it is, what it looks like, what are the treatments that are likely to come down the road, and then how to prevent them, right? So we're really talking about how can we get ahead of the problem so that they don't have this problem. Because it's super uncomfortable. I'm sure most of you know or know somebody who's had this problem, and it's really uncomfortable. So if we can avoid it, that's definitely the best cause. So just to go over a little bit, I'm going to talk about diagnosis, as I talked about, treatment, supportive care, kind of how to really comfort the person, some special considerations, and prevention, some ideas about how to prevent. So treating a urinary tract infection depends on the severity of the infection, the patient's overall health, whether the infection is complicated or uncomplicated. So generally, kind of the general approach will be the symptoms, often burning sensation on urination, frequent urge, like frequent. If you have to go every hour, the patient or the caregiver, whatever, the patient has to go every hour, that's a problem. Cloudy, strong smelling urine, that's often an indication. Lower abdominal pain or fever. By the time you're at fever, it's pretty severe. So really those first indications, usually it's the burning, and then, other things happen, but any of those things, you see those things, you want to kind of think, okay, it might be a UTI, it might be something we want to talk about. The treatments that are often used include antibiotics, of course. That's kind of the first line treatment. Hygiene is the best idea, but that's preventative. So once you already have a UTI, once the patient already has a UTI, we want to work on basically antibiotics. So there's really common antibiotics like Keflex or nitrofurantoin, which is macrobid, trimethoprim, sulfamethoxazole, it's also known as Bactrim. Fosfomycin is less common, but it's listed, so you might see it. And like I said, so then there's some complicated UTIs. So if you have a pregnant woman, you have a patient with diabetes, patients with kidney disease, those are problems that are take a little bit more, focused treatment, right? So we might see something like a fluoroquinolone, like Cipro. Those are often used for either those more advanced cases, Cipro or levofloxacin. There's also drugs called beta-lactams, like amoxicillin, or cefpodoxime. In severe cases, that could really lead to pyelonephritis, which is a kidney disease, a really, really serious kidney injury, so we don't want to ever get there. But that's when the UTI goes really deep, like way deep, and so it's preventable. It's almost always preventable, so we really want to stay ahead of this stuff. At extreme cases, it might require IV antibiotics like ceftriaxone, piperacillin tazobactam, or some other ones. But usually those are sort of either hospitalized patients or patients, maybe borderline appropriate for the hospital. So once you have a patient that has a UTI, you really want to work on hydration, right? That's also a preventative measure, and I'll get to that too, but really making sure that they're peeing, getting that stuff out as much as possible. Pain management, so pyridium, you might be familiar with pyridium. There's other stuff called like azo. Symptom relief shouldn't be used long term, right? So that's like a short term, maybe a week, but talk to the doctor. The doctor's going to prescribe it for a certain amount of time, but not ongoing, right? So if you see somebody with one of those, like pyridium or something like that ongoing, that should trigger in your mind, hey, that might not be appropriate. Maybe we should talk to the doctor or the nurse or somebody like that. So cranberry supplements have really been shown to be good preventative measures. Cranberry is just over the counter. That can be long-term, that can be preventative and going on for a while. And then there's some special considerations. So if you have a patient with recurrent UTI, first thing you want to do is education, right? Second thing is you want to kind of figure out, is there an underlying cause, right? Is there immunocompromised? Is there other risks that portends? It tells you a little bit of something about that patient. So your recurrent UTIs, prophylactic low-dose antibiotics might be considered something the doctors, less likely, but, I work in hospice, and so some of the rules that we all know and love as far as like care for younger people or any of us really kind of don't apply necessarily at those stages. So sometimes prophylactic antibiotics are good for just maintenance, right? But talk to your doctor. That's always going to be a doctor's choice, and there are definitely costs, risks, and benefits that requires education. So other complicated special considerations: pregnant women that require special antibiotics like amoxicillin or ceftriaxone, if I mentioned. Fluoroquinolone should be avoided at all costs. Elderly patients, so patients with atypical symptoms. That's one thing that I should have mentioned here in the diagnosis. The symptoms, one symptom that's so common, especially in older people, is confusion. And it's pretty noticeable, and it's pretty extreme. If you have a patient that's way more confused today than she was yesterday or he was yesterday, think about that. Why is that? That's a change. That's a different, maybe what's the cause? So being aware of your patient's sort of capacity mentality is important. Fatigue, they're way more tired today than they were yesterday. And then I want to talk a little bit about prevention, right? So we all work with patients. Sometimes those patients might have a Foley catheter. Something that's super important is to drain or empty that Foley catheter bag before you move the patient. So important. So before you move the patient, empty the catheter bag, because that urine in there, it's supposed to be sterile, right? But it's not necessarily, right? It might be, it might not be, we don't know. And so if you empty the bag, it's a lot, and keep it below the hip, right? So you want to keep the bag so the gravity is going to drain into the bag. But at all costs, you want to avoid having the urine backflow into the patient. That is a super common way to get UTI in your patient. So make sure you empty the bag before you move the patient. I've seen over my years, people take the bag, they put it over on the bed, between the patient's legs or whatever, turn the patient, and then put the bag back like nothing. But that's super common to cause UTI, and it's really uncomfortable for the patient. So in the love of your patients, and I know we all love our patients, try to think about, make sure you keep that bag below their hip level, make sure you empty the bag before you move the patient off the bed or even on the bed. So that's super important. As I mentioned before, stay hydrated. That's a good preventative measure, also a good sort of reaction if you have a UTI or if the patient has a UTI. So hydration is really good all the time, so across the board. And then having a routine of urination, so urinating frequently, and then routine, like, every few hours, right, you make sure that the patient goes to the bathroom, change their diaper so they're not sitting in it for a long time. Always things to consider it. And then it's also really important, and anybody who's done pericare or hygiene, wipe. I just want to make sure I say it right because I don't want to get it right. Front to back, right? Always front to back. Think front to back. Super uncommon to, it's very common to go mistake, right? Back to front, you introduce some of that bacteria that's on the, the other end, and that's super common way to introduce bacteria into the area where we can get a UTI. So always, always, always front to back. So that's my word. That's it. Any questions, comments, concerns, suggestions, recommendations, anything? Any comments? All right. Thank you all very much for letting me be here.